If you're over 60, there's a hidden mistake you could be making every single day that may be quietly increasing inflammation inside your knees. It isn't always heavy exercise, old injuries, or simply getting older. In many cases, it could be sitting right on your dinner plate. Stay with me, because one of the biggest surprises comes near the end, and it's something millions of Americans eat without thinking twice. I'm Dr. William Lee, and today we're separating myths from science so you can better protect your joints before the damage becomes harder to slow. Most people believe cartilage simply wears out like the tread on a tire. That's only part of the story. Cartilage is living tissue that depends on a healthy environment inside your joints. When chronic inflammation rises, the cells responsible for maintaining cartilage struggle to keep up. Over time, that imbalance can contribute to the progression of osteoarthritis, the most common form of arthritis in older adults. Research over the past decade has shown that inflammation is far more important than many people once believed, and your daily food choices can influence that inflammatory environment. Now, here's where things become concerning. Many processed foods are packed with refined carbohydrates, added sugars, and unhealthy fats that can increase inflammatory signals throughout the body. This doesn't mean eating one cookie destroys your knees. It means years of repeated exposure may create conditions that make joint tissues less resilient. If you've noticed more stiffness when you wake up or pain after walking short distances, your diet could be one factor working against you without you realizing it. One ingredient deserves special attention because it's hiding in products people often consider harmless. Sweetened drinks, flavored coffees, packaged snacks, breakfast cereals, and even some low-fat foods can contain surprisingly high amounts of added sugar. Large observational studies consistently associate diets high in added sugar with increased markers of inflammation, and excess sugar also contributes to weight gain. Every extra pound places additional force across the knee joint with every step you take, creating a double burden that many seniors never connect. But sugar isn't acting alone. Another everyday eating habit may be silently accelerating knee problems, even if your blood sugar looks normal. In just a moment, I'll explain why this pattern matters, and it's something nearly every family has at the dinner table several times a week. Before we continue, ask yourself one honest question. How many processed foods did you eat yesterday? Leave your answer in the comments because your experience may help someone else recognize a pattern they've never considered. And keep watching, because the next connection between inflammation, body weight, and cartilage health is one that many physicians wish more patients understood years earlier. One of the most important discoveries in modern medicine is that body fat isn't simply stored energy. It functions like an active organ, releasing chemical messengers that can influence inflammation throughout the body. As these inflammatory signals increase, painful joints often become even more vulnerable. That's one reason why even modest weight loss has been shown in clinical studies to improve knee pain and physical function in many people living with osteoarthritis. The good news is that your body is remarkably responsive to healthier choices. Even after years of poor eating habits, reducing highly processed foods, limiting added sugars, and focusing on nutrient-rich meals may help lower inflammation over time. It isn't an overnight cure, but it is one of the most practical steps you can take to support your joints naturally. And what I'm about to reveal next may surprise you even more, because one food often marketed as healthy isn't always helping aging knees the way people expect. That food is heavily processed meat. While an occasional serving is unlikely to harm your joints by itself, diets consistently high in processed meats have been linked in multiple studies to greater levels of systemic inflammation and a higher risk of chronic diseases that often accompany osteoarthritis. Hot dogs, bacon, sausage, deli meats, and similar products frequently contain high amounts of sodium, preservatives, and saturated fat. Combined with a diet low in fruits, vegetables, and fiber, they can create an internal environment that works against healthy aging. This doesn't mean you have to give them up forever, but it does mean they shouldn't become everyday staples if protecting your knees is one of your goals. Here's another surprise that many people overlook. Some foods advertised as low-fat or heart-healthy compensate for flavor by adding refined starches and sugars. These products may seem like smart choices, yet they can trigger rapid spikes in blood sugar. Repeated blood sugar swings encourage oxidative stress, a process that can damage cells throughout the body, including those involved in maintaining healthy cartilage. Researchers continue to investigate how these metabolic changes influence joint health, but the overall message is already clear. Whole, minimally processed foods consistently outperform heavily processed alternatives. Now let's talk about what your knees actually need. Cartilage depends on nutrients delivered through the fluid inside your joints. While no food can magically rebuild cartilage once it's severely damaged, eating a balanced diet rich in colorful vegetables, berries, beans, nuts, olive oil, fatty fish, and adequate protein supports the body's natural repair systems. These foods provide antioxidants and healthy fats that help the body regulate inflammation instead of fueling it. Vitamin D also deserves attention, especially in older adults. Low vitamin D levels are common after age 60 and may contribute to weaker muscles and poorer physical function. Strong muscles surrounding the knee help absorb shock with every step, reducing stress placed directly on the joint. If you suspect you're deficient, speak with your healthcare provider before starting supplements, because the right dose depends on your individual needs. Movement is just as important as nutrition. Many people avoid activity because their knees hurt, but complete inactivity often makes stiffness even worse. Gentle walking, swimming, cycling, and professionally guided strengthening exercises improve circulation, support the muscles that stabilize the joint, and help maintain mobility. Even a few consistent minutes each day can make a meaningful difference over time. The biggest mistake I see isn't eating one unhealthy meal. It's believing that joint damage happens overnight. In reality, small daily habits quietly shape the future of your knees for years before symptoms become severe. The encouraging news is that those same daily habits can begin working in your favor, starting with your very next meal. That's a powerful reminder that it's never too late to make changes that support healthier aging. If you've been living with knee pain, don't ignore it or assume it's simply part of getting older. Early evaluation and a personalized treatment plan can help preserve function and improve quality of life. Every step you protect today is an investment in your independence tomorrow. Now I'd like to hear from you. Which food surprised you the most, and have you noticed certain meals make your knees feel better or worse? Share your experience in the comments, because your story could help someone else. If you found this information valuable, subscribe and turn on notifications so you don't miss our next evidence-based health warning designed to help you stay active, protect your joints, and enjoy more healthy years with the people you love.